Therapies for anorexia. People who have anorexia nervosa are not just overzealous dieters. They are individuals who are suffering from a serious condition which requires special needs or therapy help during the process of recovery. External help will most likely be necessary to begin and maintain positive eating behaviors and attitudes to food and body image. Successful treatment is as much to do with emotional healing behavior patterning as it is to do with physical repair. Anorexics who are willing to undergo treatment have options to choose from that have been proven successful for others, including the following therapies. Some of the theory and methodology of treatment programs overlaps others, but all have their success stories for anorexia sufferers. Cognitive Analytic Therapy, CAT. Cognitive Analytic Therapy or CAT helps people who struggle with anorexia nervosa based on the premise that such condition occurs due to an existence of unhealthy behavior and thinking. There are 3 different stages of CAT that anorexics will undergo during therapy. Reformulation. This is when anorexics will be asked questions that will eventually lead to an answer that defines a specific experience or moment in their life which triggered their condition. Some individuals who have anorexia nervosa were found to have experienced a traumatic experience during their childhood which has triggered their adverse eating habits. Sympathetic understanding is required, as although the pivotal event may appear minor to others, it has obviously been very impacting for the patient. Recognition. This is the stage when an individual will be led to recognize and admit to their unhealthy eating behavior patterns. At the same time, they will also be helped to acknowledge the impact of these unhealthy eating patterns and their perceptions about food on their health. Revision. Once an individual has gone through the stage of admitting to their unhealthy behavior patterns, they will then proceed towards making positive changes to these behaviors and habits. Cognitive Behavioral Therapy, CBT. Cognitive behavioral therapy for anorexia nervosa operates based on the assumption that such eating disorder develops as a person's way of coping with a negative experience associated with distressing events. For example, separation from parents, having issues with a boyfriend or girlfriend and/or disturbed family relationships, among others. Cognitive behavioral therapy also begins with the assumption that these extreme dietary restrictions were generally born out of a person's aim of having a sensible diet to be able to lose weight. However, as the person begins to wrongfully assume that they need to lose more weight, they also think that their weight loss efforts must be done with greater intensity, thus the anorectic process eventually develops. Focal Psychodynamic Therapy, FPT. This is a therapy which is based on the theory that a mental health condition occurs as a product of unresolved issues in a person's past or during their childhood years. Focal psychodynamic therapy encourages anorexic individuals to recall how their childhood experiences affected them. The process involved in this therapy is geared towards finding more effective ways of helping patients cope with stressful events and the negative emotions and thoughts associated with them. Interpersonal Therapy, IPT. This type of therapy operates based on the belief that an individual's relationship with others and the outside world can have a powerful impact on their mental health. For people with anorexia nervosa, their habits and behavior largely occur due to having low self-esteem or self-doubt when dealing with other people. Interpersonal therapists will help anorexics explore those negative issues surrounding their interpersonal relationships. Once these negative issues are identified, the therapist will then help the anorexic person figure out how these issues can be overcome and resolved in a way that their anorexic behavior will also subside. Targeted Nutrition Therapy. Research reveals that a deficiency of the mineral zinc may play a role in the development of anorexia nervosa. The importance of zinc in brain health cannot be overemphasized, as this is one of the most abundant trace elements in the brain. A deficiency of zinc will increase the susceptibility to mental health problems including anorexia nervosa. Vitamin B deficiency has also been found to overlap with the many symptoms that are seen among anorexic patients. As anorexic individuals are profoundly malnourished, a targeted nutrition therapy must be an indispensable part of the treatment plan. If you liked the video, give it a thumbs up, and don't forget to share with your friends. Thank you very much for watching. For more nutrition, health and beauty tips, please subscribe to our channel.